Hi. Okay, I've got another interesting topic. Numbness during sex. Sex problem number 19. Now, y'all think you don't have any numbness. I'm telling you do, okay? We all have some sort of numbness, depending, of course, on the age. When you're younger, y'all are fine. But as you get older, that numbness, and sometimes in the younger folks too, that numbness comes in. So, what is numbness? Okay? Numbness is a problem with sensation, all right? So the nerves that are connecting your skin or whatever organ we're talking about to the brain is having a problem, whether it's inflammation, damage, something's going wrong, and you are experiencing numbness, okay? Now, numbness normally is in the fingers, the toes, the legs. We know about that, right? It's pretty common. But here I'm talking about numbness during sex, and you'll be surprised how they are connected. The numbness that you have generally can involve your groin, okay? Your sexual organs. Okay. So we call that penile sensory neuropathy or genital sensory neuropathy. All right, I want you all to understand that. It's very important because it can happen in the penis, it can happen in the clitoris, it can happen in the genital area, which means the scrotum, the perineum, the anal area, the pelvic floor, again, and the um, lips, the vulva, the vagina, right? So we don't really pay attention to it because it's not something that we actually notice. And there are not many studies on this, okay? So remember, a lot of what I'm saying is based on my experience. And you have to consult with your own physician to make sure that you can evaluate yourself for numbness, okay? All right. So, why do I talk about it? Because if you're numb, you really cannot feel the other person's sexual organ when you're performing the act, or the person that is being performed on cannot feel the, you know, sensation of the person that's actually partaking and performing sex on them. So again, it's very subtle. So you might miss it. So that's why I'm bringing it up. I'm going to spend a little bit more time on this than usual, even though I do talk a lot, but this one has a lot of stuff to talk about. So if you notice that the orgasm in men and women is not optimal, is not at its peak, we've got to look at your sensation, your numbness. Okay. So, a simple way of knowing without even going to a doctor, right in your house, you would notice that your toes, your fingers tingle. All right. So, that tingling is a reflection of some injury, some inflammation with the nerves, and that can happen. Okay. So, the tingling can be a reflection of the nerve damage or the numbness, the lack of sensation to that area. Fingers, toes, can have either one. And so when you stand in the shower and your toes are a little bit different, you can actually stand even without being in the shower, and you can notice that they're a little bit different in terms of the rest of the foot. Same thing with your fingers, the rest of the hand. It's a little bit different sensation. So once you get that, take note, there is something going on. And I'm going to tell you, you got to get to your doctor, get that history and physical done, get your physical done so that we can know whether you have any medical issue going on. So I'm going to talk about some reasons why you would have neuropathy. Number one, medical condition, like I just mentioned. Diabetes is the first one that comes to mind because the sugar damages the nerves. Multiple sclerosis, okay? That's a myelin sheath abnormality, all right? It's damaged. And so your sensation really is affected, okay? So very important. You have any sensory issues, get evaluated by a doctor. Okay, there are other neurological diseases also. I'm not going to go into the detail. If you have any, that can affect your sensation. Okay, poor circulation, that is where you're going to have blood flow issues from the veins and from the arteries, right? And if you don't supply the nerves through the arteries and through the veins draining, you can have a problem with the nerves, which will cause numbness in those areas. Okay, so remember, S2, S3, S4 comes from the sacral area. Okay, so we're sitting, like right now, I'm sitting on the area where the sacral nerves come out. And if those areas are damaged or not working well, that's what supplies the penis, that's what supplies the clitoris, that's what supplies the genital area. And so you want to also make sure that that is evaluated, okay? So you want good circulation there to feed those nerves, okay? All right. Number 3, medications. Antidepressants, antipsychotics are the most common ones. So we already know that those antidepressants affect the orgasm. So please make sure you get evaluated for that and change the medication with your doctor's permission if need be to enable you to have that orgasm, because it can actually make you not feel anything. And then you're like, what's going on? What's going on? That could be one of the effects of the medication. Hormonal imbalance, right? So I know I love my testosterone, and I know that hormones are crucial, right? People always say, Dr. Kathy, my hormones are off. And I say, okay, let's get them checked, right? So get your blood levels checked for the hormones, find out whether this is a problem with you. And it can be at whatever age, okay? Those hormones, especially in women, estrogen, we need it. In men, testosterone, you need it, are crucial in making sure that your organs get good blood supply and function well, and good contractions and good muscles. All that works in conjunction with your nerves. Otherwise, your nerves will be isolated and, wondering what's going on, because it's not working in tandem with the other parts of your body, which is the circulation and the muscles. So you really want to have that good blood flow in that area that will help the hormones do its job. Okay? Nerve compression. Now, this is a big one. Nerve compression, damage from external sources. Huge. I'm going to give you some, okay? Number 1, the cyclist, right? Motorcycles. You guys that ride bikes, motorcycles, all that jarring on the S2, S3, S4, S5, you're going to find that you're going to get numbness, okay? And you won't realize it. It's very subtle. Remember, it's something you don't really notice. So you've got to be aware that it's possible and get it checked. How do you get it checked? Go to the doctor, but you can also check by actually putting a feather and seeing whether you can actually feel the feather, right? Same thing with your toes, fingers. If you feel different up above versus that area that you're concerned about, get a doctor to see it and evaluate it, and then see whether there's a reason why you're having, because there could be so many different reasons. But in this case, motorcyclists, cyclists, they have issues because the pudendal nerve, which is coming from S2, S3, S4, is either compressed or entrapped. Okay, so I have all these things I've written down. So the pudendal nerve entrapment or the pudendal nerve compression is a syndrome, or is a problem that has to be addressed. And it can be treated, right? Sometimes surgically, but you've got to first of all figure out how bad it is. Has it been severe? Has it been cut? Is it entrapped? Is it compressed by other organs in that area, or by something that's growing, right? Or just again by the pressure from the saddle, right? So you're in that seat, the motorcycle, the bicycle, and if that seat is not positioned properly. So you want to make sure that saddle is not forward, because if you're forward, you're pressing more likely on the pudendal nerve versus being backwards, where you're actually off the pudendal nerves and you're more on your bones of the sitting area, right? So you want to be on those bones rather than being on the perineal nerve or the pudendal nerve or the perineum, right? Because that perineum and the pudendal nerve is in that area. So all those nerves come there. You do not want them damaged, otherwise that it can affect you sexually. So you want to adjust the saddle, right? You want to sit in the middle of the saddle. And if you can get a cutout in that saddle, it'd be great, because then you'd have that cutout in the middle that doesn't put pressure on that area, the pudendal or perineum area, okay? Also, you can wear padded cyclist shorts, right, guys, girls? If you're cycling a lot, get the padding that will protect that same area. You can also stand, take breaks, right, on the bicycle, right? Sometimes get off that area to give it some breathing space so that you can actually have a break in terms of not having pressure consistently on that area. The riding position, again, you want to get off of it, sit more straight up instead of leaning forward all the time, or at least do a variety of it so you're not always leaning forward. You can adjust the handlebar, right, and make sure that you are having some ease in terms of adjusting your position off the perineum, off that forward slant. The riding style, same thing. You want to be upright. You want to sometimes use the bicycle that is called a hybrid or a cruiser bicycle that tends to not, that's for the cyclist, that tends to not allow you to lean forward. And you can distribute, again, the weight more on the bones of the buttocks or of the sitting area rather than forward. Okay, so those are some of the compression areas that can actually affect your nerve. Okay, now I'm going to give you some more areas that you're going to be surprised about that can affect the pudendal nerve. All right, so we said cycling, horseback riding, pretty much the same as when you're riding a bicycle or when you're motorcycle riding. And again, motorcyclists, you guys do long distances. So please protect the perineum, protect that area, okay? Even running, long distance running, right? All that jarring, boom, 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 boom. Gravity pulls down, it affects that area. Get good support. Make sure that you are not just hitting that area consistently. Take a break as much as you can, and if possible, don't do it too much, okay? All right, we have rowing. When you row, right, you're sitting in that boat for a long time and you're taking that paddle, so that consistent sitting in the boat and that consistent movement on the nerve affects the pudendal nerve and your groin in women and men. Remember, the pudendal nerve serves both. The pudendal nerve supplies both the penis and the clitoris, which is very important during sexual activity to get aroused, to get your orgasm. We need that whole area to be happy in terms of having a great nerve and circulation supply. Okay. Even with your regular work, occupational sitting, right? Truck drivers, boom, 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 boom. You get all of that jarring. So you want to get a good cushion. Make sure that you're not hitting that genital area, the perineal area on a hard surface in your car, the seat. So you want to get nice cushion and again support in terms of what you're wearing, pants. Of course, we prefer boxers, not briefs, because the briefs are a little bit too tight. You want to get it aired. So make sure you're having a good support in terms of your genital area. Make sure you're not sitting too tight and holding it, your legs too close together. Make sure that there's some relaxation in that area. The muscles are relaxed. And air, right? Freedom, not heat, heat, heat. We don't like heat in those areas. So that desk job where you're sitting a lot, stand up, take a break, walk around. Weightlifting, huge. You won't believe it. Weightlifting, what it does is when you're doing those squats, you're going down, or you're lifting heavy weights, you're putting pressure on the pelvic floor. So the pelvic floor is getting all this weight on it, and you're trying your best to get back up again. So all that gravity, all that pressure is going to that particular area, right? It's like a fulcrum. And then you think it's not doing any damage, but the more you do it, the more damage is being done. And that's where you get those hernias, right, guys? We always want to get checked for hernias. So get that physical exam done. Yoga, Pilates, they actually stretch those areas, right? So it can be good, but what if you overstretch it? What if you overdo the yoga or the Pilates? Overstretching that area can be damaging to that nerve. So you want to protect and baby that nerve when you're stretching and doing your yoga and Pilates, right? So just make sure it's not causing any pain or any distress. Make sure it's gentle. Make sure you get into that position of stretching slowly and not suddenly, not jarring, okay? Sexual activity is another one that has a potential of damaging that pudendal nerve. The position can be a little bit too much for the pudendal nerve. And why I say that is my sister mentioned to me one of these dark tales. I love watching dark tales. They're comic drawings of different activities. And she says she reminded me of this one of their posts that they had the woman wondering what's he doing with a wheelchair. So the boyfriend's coming with this wheelchair, and he says you're going to need it because he's going to do something to her sexually that she's going to not be able to walk. Right? That's what it implies. So I thought it's so funny that she brought that up. Kathy, you mean that that's what happens when you have too much aggressive sex? Yes, if it's too aggressive, it can damage both the man's genitals and the woman's genitals. So you want to be careful with a little bit too much, especially if it's frequent and it's like gets worse and more, it's harder and gets more aggressive. Gotta be careful. Once in a blue moon, fine, but consistent hard sex on that area can damage the nerves. Okay. Water skiing, right? Jet skiing, again, same thing. Gravity, that seated position, jarring motion, riding the waves. Those waves are just pounding your legs and pounding up into the genital area. You've got to be careful that those areas are protected. I want to mention low back pain. So if you got low back pain, and especially what we call radiculopathy, where the nerves are shooting down, the pain from the nerves being damaged are shooting down the legs to the foot to the leg. You got to get considered. You got to consider that that might also be affecting the area of the genitals. So that in both men and women, you want to be evaluated for that. So again, leg pain, low back pain, foot numbness, leg numbness is telling me that the nerves to the genitals are being affected also, depending on how high the damage goes or what nerves are affected. Again, those sacral nerves are the ones that are more affected. So if you have a lumbar issue, it usually doesn't affect the clitoris and the penis, but it can affect the general area and therefore affect the whole pelvic floor, which we also want to be nice and strong. Okay. So the areas that I wanted you to know is that you can be thinking you're normal, doing things that are easy, and you're having problems because you think it's easy, but it's really not. Okay, so just remember those areas that can also cause nerve damage or nerve compression, the pudendal nerve syndrome, which is either a compression or an entrapment. Okay, all right. Performance anxiety, stress, right? So that is going to affect the brain, and we need the brain to communicate properly with the nerves. So if your brain is disconnected from your nerves, the pathway to the groin, you're not going to be able to have a great circulation, or sorry, in terms of neuropathy, you're not going to have a good supply of nerves because there's something going on up there that's not allowing the connection to be properly executed, right? So you do want to have less stress, less anxiety. So that's one of the ways that anxiety can affect you negatively, right? So we want to make sure that we get that addressing as a psychologist or therapist. And that performance anxiety, again, that's connected to that too. So make sure you see someone for that. Alcohol or substance abuse. We do know that alcohol damages nerves. That's a given. You all know that. I'm sure you all know that because we know what it does to us. So the drugs also can do that. Please get off of that stuff, especially when you're having sex. Now, I know that some people have a lot of alcohol and do drugs during sex, but if you're having a problem, get off of it, right? If it's not something you can control and it's causing physical ailments or physical disease or physical problems, stop, reduce it, go to a doctor, get some help to reduce how much you're doing, okay? Again, psychological issues versus anxiety. Psychological issues will be something like a trauma, PTSD. That is very severe, especially if it's bad. That can cause a disconnect between the brain and the nervous system and your sexual function. So please get some help with that. The emotional stress from the psychological issues, when you have emotional issues, and you add the trauma, right? If you have a physical trauma and you have an emotional trauma, that's going to cause psychological issues, which is going to just make it much worse. So you want to make sure that you're having some treatment from a psychiatrist, psychologist in terms of either sexual abuse, sexual assault, so that we can get that healed. Remember, I told you about a patient that could not walk. She came to my office. She brought all the exams, the test results, the MRIs, the CAT scans with her husband, and she would not open up about what had happened to her in the past regarding her being abused by her mother's boyfriend. She couldn't talk about it. She said she could never talk about it because if she did, she would have to accept and acknowledge that her mother did contribute to her sexual abuse by giving her to the boyfriend. So she couldn't deal with it, and I really encouraged her to. But she left my office without dealing with it with a walker and could barely walk. And so that's called a conversion disorder. So you really want to make sure that trauma, psychologically, you're free of that. Remember, it's about you. You put yourself first. You don't let anyone take away your joy. Always make sure you take care of you first, okay? Condoms, yes, condoms can cause nerve damage, right? The bad, horrible, if it's not the right size, if it's not the right texture, if it's not, if you're allergic to it, things like that will cause, again, your nerves on the penis and in the woman, the vagina, to be numb and have a problem in terms of sensation. Desensitization is huge, right? We talk about the toys, we talk about masturbation with that, and you'll find that if you overdo masturbation, remember I told you about a guy that does it 80 times. I'm like, no, 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 you can't do it 80 times. I told that story before. You have to do it a few times, not too much. There's a delicate, line there, right? You do it enough, it's good exercise. It will actually help your sensation. You do it too much, you cross that line, it deadens it. It destroys the nerves in that area. So you do not want to use aggressive, very strong vibrators or toys in the men or the women in those areas because it can cause damage. And you don't want to use it frequently, right? So if you're doing it, you don't do it every day, right? So you're going to try and not overstimulate the area so that the nerves don't get damaged. Um, I do want to talk about a little bit in the women because they're a little bit unique. Childbirth, right? We give birth, vaginal deliveries, and we know those that do C-sections don't have this problem. But the vaginal delivery, it does stretch the pelvic floor, the vagina, all those areas, depending on the size of the baby. A 6 pound versus a 7 pound versus a 10 pound baby, right? The head coming out can be very, very stressful on the pelvic area. But normally we bounce back, right? Especially when we exercise, we make sure we do those Kegel exercises, etc. So you do want to make sure that you are, after childbirth, okay. Otherwise, it won't come back. And I talk to people about the G spot. It stretches that G spot that it's like you can't even find it, you can't even feel it. So you don't want to not address it. So when you're having babies, okay, just be aware you need to do those pelvic floor exercises, Kegel especially, to get it back. Guys, you too do Kegel exercises because it's really good for the pelvic floor, keeps the nerves exercised, okay? So menopause in women also, you got to be aware that when those hormones go down, you lose sensation. Okay, especially estrogen, right? Because we get dry down there. You need that estrogen to come back and give you back your moisture and your lubrication so that you have a healthy, not atrophied or dried up area down there that will encourage the nerves to be damaged because it's too dry for the nerves to survive and function properly in. So you want to address those hormones, get checked, go to your doctor like me that knows how to check hormones in men and women. So the women are the ones that are going to have more of a drastic area problem because again our levels go down to almost zero. Guys hardly go down to zero, but you guys do go low. But get that estrogen, progesterone, testosterone checked in both sexes. Pelvic surgery. Now that's a huge one because I know that vaginal rejuvenation occurs, right? Some women are doing that vulva repair, clitoral, you know, I guess, reduction if it's too big, and trying to make that area look great. Be careful. Make sure the doctor knows what they're doing. Make sure we're at the age where you understand consent, where you understand that surgery can affect nerves, right? So make sure the doctor that you're dealing with knows exactly what they're doing. Don't go to any doctor that doesn't know what they're doing. Make sure that you talk to the office and ask for some patients that might give you some back uh, information, feedback regarding your or their experience with the doctor. Because I always encourage my patients, just ask the office, can you speak to some of the patients that have had the same procedure that you plan to have, so that you have a better knowledge of how they had that experience with that doctor, whether they had a good experience or a bad experience, right? So you do not want to do that unless you have someone that's been doing this for a long time, expert in that area. Okay. Um, FGM, female genital mutilation, will numb the area. Y'all know that. That's one of those topics that I find very hard to talk about. But there is help. I've helped patients with that. So please reach out to your doctor. Find someone that can help you that have had the genital mutilation where it's been cut in different stages. You have 1, 2, 3, 4 stages. So please get out and get some help. Please, please, please. Birth control pills. That is another thing that can affect numbness. You'll be surprised. Some of the birth control pills actually are synthetic hormones. They knock down your natural hormones. They're trying to be your natural hormone, but they're not. Some people are very sensitive. Watch those birth control pills that can also affect numbness in terms of the sexual act. Okay? All right. So I want to talk about the treatment, or what you do when you go to the doctor, right? You get that history done. They're going to ask you questions. We're going to ask you questions. You get the physical done. We're going to examine you. We're going to get some blood work done. We're going to check your hormones. We're going to check your sugar, your liver, your kidneys, your thyroid. We're going to check all that out, your cortisol, hormones. Then we'll decide whether that's the problem. We can also do a nerve conduction test, right? We can check the nerves, the legs, in that area. We can do an ultrasound. We can do a Doppler of the genitals, again, penis, clitoris, pelvic floor. We can check and see whether the blood flow is doing well, because all that, if it's hampered and it's not working properly, can affect the nerves. Sensation, okay? Remember, sensation is very important. You've got to find out, are you sensitive? And you're going to know it. It's hard sometimes to know, but you're going to know because your feet, your legs also are having a problem too, right? Okay, or your fingers. Treatment. Okay, so treatment can range from, like I said, everything we talked about, you want to address them, right? All the above issues we talked about, I want you to address them one by one, especially if you have that. Physical therapy, huge impact, okay? So you go to a physical therapist that knows how to strengthen the pelvic floor, and then, of course, you do that at home regularly. Kegel exercises, very important to make sure that those muscles are working well and blood flow is going through properly. There are topical vasodilators, L-arginine, all right? So we can put L-arginine on there, especially with, doctor's advice. L-arginine and nitroglycerine. These are compounded things that we can make in the compounded chemicals or creams that we can make in the compounding pharmacy when we want to give that extra blood flow to that area. But remember, go to your doctor and discuss that with your doctor. Again, hormonal creams. We can get the women some vaginal creams, especially estrogen, which is awesome for reducing the dryness. It doesn't really treat the nerves, but it makes the area conducive for the nerves to function and work better because they're going to be happier in that hormonally balanced vagina, right? Capsaicin, that can cause some burning. That's for pain, for people that have pain with neuropathy. You sometimes want to address that. One of my favorite is my sex oil. I've talked to you about it before, the emu oil. And I do have emu oils that have some CBD oils in it. But CBD oils also, again, not studied, are supposed to be very helpful in terms of sensation, lubrication, which is going to be, again, important for the nerves to be in a good medium, in a good, area where they can work and function properly. Then we talk about sometimes menthol, peppermint can be a little bit, again, uncomfortable, but it's very good for circulation. And that area might be a little bit more sensitive, so you might not want to use that. But you do have, again, lubrication, natural lubrication especially, that would be good. I don't like synthetic lubrication. I like the natural one. Again, talk to me about the different ones you can get if you want to DM me or send me a message, comment. But you can get some natural oils, and I really do love my emu oil and the CBD oils. But remember, you got to get the good quality one, okay? Which, I can tell you about. Also, the Pudendal nerve decompression surgery can be useful for those that have a compression of the pudendal nerve. And then supplements, okay? Supplements are one of my favorite topics, and I like to measure your supplement levels, meaning your vitamin levels, right? So vitamin D, B12, folic acid. Folic acid is crucial for your nerves. So you want to get those B vitamins evaluated. And some other supplements would be alpha lipoic acid, omega 3s, great for inflammation. Again, L-arginine, like I said before, opens up the circulation. Vitamin D, love my vitamin D. You all know I love vitamin D. CoQ10, coenzyme Q10, very good for the circulation. Turmeric, anti-inflammatory. Ginkgo biloba, questionable. They say that it does help, of course, circulation in general, but we haven't really studied it in terms of nerve function. But of course, if it helps the blood flow or it helps circulation, we can infer that's going to help the nervous supply too. But there's no documented proof. We still need to do more research on that. But I do love ginkgo biloba. Talk to your doctor. And zinc. Zinc is well known to be very important for nerve function. And when we take too much zinc, it can be dangerous. All right. So you do not want to take too much zinc. Make sure you get your levels checked. Talk to your doctor. Find out what a recommended dose would be for you, and see whether we can help reduce and improve the numbness during sex. Okay, guys? All right. Good talking to you. I know I talked too much today, but I'm going to talk to you again tomorrow or later today, and we'll see what is going to be our 20th sexual problem and solution. And I might end it there. We'll see. Okay, guys? Bye.